Mr. Prem was a 65-year-old gentleman, and came to me in my clinic saying that his wife was very annoyed nowadays. He's bumping into object at home, but he's finding it's not his fault. Till he had a recent accident when they were driving. According to his wife, she was sitting next to him in a car. A bike came onto next to him, which is very visible to her, but the driver, Mr. Prem, went and dashed and started an argument. When they came with this history, then I started asking him, when you read a newspaper, do you see the entire newspaper? Then he says, I used to find it, but nowadays to the corner I had to turn and see. Then it clearly showed one half of his visual field, there is something abnormality. This usually happens when there is a pressure on the eye. In the center of the eye nerves where they merge inside the brain, we call chiasm, where it merges together. And we had to investigate such patient to find out what is the problem. In fact, they've gone to ophthalmologist. They said everything is within normal limit. But what was not done for him is called visual field test. So it is a separate computer test where he will be under the computer. The small mouse will be given to him. When you do, we can plot the visual field in a circular way in 4 quadrants. And in his way, in his test, when I did it, one half of one side, other half of the other side, he could not see. This we call bitemporal hemianopia. So this is classical of the tumor which arises in the pituitary gland. Then I had subjected him to the MRI, and in MRI, to my surprise, a large tumor which is sitting in the base of the skull below the optic nerve, pushing the optic nerve completely up, and which is causing the complete blurring of vision to this person. And in fact, all his tests were normal. Then when I told them about the word tumor, they were shocked. But believe it or not, every tumor is not cancer. And this pituitary tumor is 99% will be always benign tumor. But when it is of that size, with that amount of visual problem, 100% they need a surgery. And with my explanation, they were very happy. They understood what I was doing. When I showed them in our new technology, where we can put that in the virtual reality and augmented reality, I showed where exactly is the optic nerve, where is the tumor coming, where it is pressing. They understood that the only way to get the relief of it is to take out the tumor away from the optic nerve. And I did the surgery within 7 days, and believe it or not, in 7 days, his vision completely clear. So this is the kind of a pituitary tumor we call non-hormone secreting pituitary tumor, which always comes with visual problem, which is subtle in the beginning, but when left alone, it can turn into blindness. For that, you have to always consult a neurosurgeons, people like us in a department like Neurosciences at Aster Whitefield, where your own history, what you give, with our long years of experience, we can, without even diagnosis, we can sometimes recognize that. And when we do the MRI, even the patients will get confirmed that, yes, what my doctor is doing correct. And then with surgery, you can be cured permanently. Believe it or not, these tumors can be permanently cured through the surgery done through the nose with an endoscope. So in that way, consulting a specialized brain tumor center like Aster Whitefield, a great advantage will happen to the patient, both in investigation, technology and surgery.